This is Dr. Jiu-Jitsu, your go-to podcast for combat sports, military performance, injury prevention, and treatment. Now here's your badass host, Dr. Megan Jimenez.
Bow to your sensei!
Hey guys, I'm Dr. Megan Jimenez. I'm an orthopedic surgeon specializing in sports surgery and jiu-jitsu brown belt. I'm here with my mentor and good friend, Dr. X, who is originally from California and completed his medical school and training in Atlanta, was in Pittsburgh and at Vail for some of his training to be a sports surgeon. He is very well versed in ACLs, and that is his main focus. So I'm really excited to have him here today. Thanks for coming on.
Anytime. Thanks for having me.
Yeah, it's awesome to have you here and be in your awesome house. And I want to talk to you about how you got into orthopedics. What brought you to this route?
You know, it's kind of interesting. When I was probably first year, no, I was in 8th grade, and I had Osgood slaughter, which is when you grow too fast and you have pain on the front of your knee. And they wanted to bring us to the pediatrician. I wouldn't go because the guy a year before me that had it, the guy said, "Oh, you can't play sports for a year." And so I just didn't complain and didn't go. It hurt, but I knew it was, I didn't want someone to tell me that. And then in high school, I was frustrated because every time you got hurt, they send you to the pediatrician. And if you got lucky, I didn't even know what an orthopedist was, they sent you to orthopedist. When I broke my thumb, and then I had a guy who actually kind of understood sports a little more, that was really helpful and really helpful for me because he understood that I wanted to get back to play and didn't just say, well, let's just keep you out for 3 months. Right. And that kind of led me all through, played football in college, and our team orthopedist, was helpful. But again, not a guy who ever played the game. And that, I said, I want to do that, but I want to come at it from a different perspective because I've been there. And I think that is what made it my lifelong goal.
Yeah, I think that's super important. Doctors participating in the sports that we're treating athletes in, because, for example, with jiu-jitsu, with fight sports, I have a whole different understanding of how athletes are hurting themselves. And, when they get back to sport, hey, can I do this move? Can I do that move? So if you don't know, you might just say, you're out for 3 months, don't do anything.
Yeah, absolutely. And I think when taking care of athletes, even if you've played a sport and you train, especially something like football, okay, there's contact, head injuries, it's violent. You train very similarly now to the way most other athletes are training. It's a lot of weightlifting, it's explosive movements, you do endurance work. It's very different than being a cross-country runner. But I think you still have to learn about these sports. I mean, I didn't know much about Brazilian Jiu-Jitsu, but my roommate in college is a guy named Tim Lasik. And Tim was a defensive tackle and a heavyweight wrestler. And he was actually fought in, I think, UFC 29 or 30.
Early on.
One of those two. And I learned a lot about, because he started boxing, then he started getting his other stuff, and I didn't know what the hell it was, but I just started watching him and Ken Shamrock and these other guys fight in UFC, and you started to get some understanding of what's going on. Then you kind of become interested, and you spend a little time talking to people like you or Chris Arazzi or other. I've taken care of a bunch of MMA guys at this point. A lot of them are, especially Brazilians, are all jiu-jitsu based. So you learn a lot about their sport, and I think that's important with any sport you take care of.
Yeah. So with jiu-jitsu in particular, injury patterns, what's the worst you've ever seen, or fight sports in general?
In fight sports, it's funny. In boxers, it's you see the broken hands, you see a lot of dislocated shoulders. You don't see as much knee stuff. You have to understand that if you have a lower extremity injury, much like a baseball player, you're going to lose your power and your velocity. So like when we have baseball players who hurt their ACL, you got to be very careful when you return them. They're not going to return and throw really well within that first year. They're not strong enough. They can throw again, but if you let them return to the mound too early, they're going to hurt their shoulder, they're going to change their mechanics. So similarly with boxers or any strikers, you're not going to have the striking power if your lower extremities aren't strong.
Yeah, it all comes from the base.
Right. And then if you get into, your wrestlers, you got to be very careful, what type of ACL you do on them. They spend a lot of time on their knees. They need hyperflexion. Oftentimes when we fix knees, we'll say these people look fine, and a football player could lose the ability to bend their knee. If that, no one's going to take a football player and put their heel to their butt, okay? And unless it's by accident. But you do it in your sports.
Yeah. When I was returning to sport after my ACL, I remember particular being at one of the Emory PT facilities, and they were like, "Oh, your range of motion is 0 to 140 degrees," and I was like, "That's not good." They were like, "That's excellent." I said, "No, I need like 160, right?
You need
My
to be
knee
equal.
to be sitting on my heels, right? So it's very different."
There was one of my old football players who played for the Cowboys, and he's coaching at Texas right now. He's a running back coach, and I did a simple operation on his knee, no big complex thing. But he played again 2 weeks later. It was in the playoffs, and they interviewed him with someone and said, "Hey, how was your knee?" He said, "Fine, well, no problem." I talked to him. I said, "Hey, Tashard, how was your knee? It didn't hurt you?" He goes, "Hell yeah, it hurt." I said, "Well, you didn't say that." He goes, "They didn't ask me that. What they asked me was, how did I do? My knee did fine." He said, "If someone tackled me and pushed the heel to my butt, I would have passed out." And it teaches you a lot, because we'll go in on these wrestlers and we'll do a simple little meniscal surgery. We're just trimming something up, but they're back training on the mat within a week. But they're not ready to. If someone is riding them, or someone in jiu-jitsu submits them, they're going to tap out. When you get that, it's horrible.
It's going to swell.
And it takes time to get that flexion back. So those are the little things I think it's helpful to understand the sport when you're working with athletes.
Yeah, and something you brought up there, a meniscus like trimming, right? That meniscus, a lot of people, they've heard the word, but they don't know what it is. And then when you talk about a trimming versus fixing it, you said he went back in a week. But if you're doing different surgeries on the meniscus, it's very important.
And people, when people are talking to people like us, I'm not very, my language is kind of one of a miscreant rather than, someone who's trying to be smart. But you have to make sure you understand everything we're saying. And if you don't, I try to look at it and say, and make it as simple as possible, because the person needs to understand what's going on with their knee. Very similar to me, you coming in as a jiu-jitsu person and telling me, well, I did this, I got him in a Kimura, I did this, and I'm going to go, okay, I think I know what you mean, but you better just kind of go over that slowly so I really understand, what your transition from move 1 to 2 is, so I understand that. You have to be the same way, and ask me those questions like that so I can explain it to you. So like a meniscus is a piece of gristle that looks like a C shape, and it's a pad inside your knee, like a brake pad. If you tear it, part of it has blood supply. We can sew it together. That's called a repair. And when you sew it together, that takes time to heal. If it tears where there's no blood supply, then we just trim it. That means I trim the meniscus, but people say, "Oh, my meniscus was repaired," and use that to mean both things, and it doesn't.
Yeah.
But then I say, "Hey, you can get back as soon as you can." But realistically, it's about 6 weeks for most athletes to get back working after a minute. You can do it sooner, but you're going to have pain.
Yeah. All right. So there was a recent paper out in 2021 talking about most common jiu-jitsu injuries. I thought it was super interesting. Most people they talked to were competitors, so probably getting after it at a higher level. And what they showed was that the most common injury was the knee, to your point. The most common ones being meniscus, ACL, and MCL. So we kind of touched on meniscus a little bit. Can you talk a little bit about ACL, MCL, surgery versus no surgery?
Sure. It's interesting. As I see more and more injuries, I'm starting to see guys 40 to 60 starting to get involved in jiu-jitsu who've never done wrestling or anything ever. And they're having a blast doing it. But you're seeing, so in that age group, it's funny, we're seeing a lot of groin injuries. Okay. And we're seeing a lot of, because guys don't stretch, they lose pliability. And so we're seeing a lot of groins, we're seeing a lot of muscular tendinous injuries that aren't necessarily surgical, they're just irritating. And in some cases could be debilitating. When you look at a knee, you got to think of your knee as just two bricks on top of each other. And they're held together by 4 rubber bands. You got a rubber band on each side that prevents your brick from going this way, and 2 rubber bands in the middle that control this and also rotation. The 2 most common injured of those rubber bands are the rubber band on the inside part of your knee that goes on, right underneath your skin, and that's called the MCL. Now the MCL is what an injury to the MCL happens when you get hit from the side. So think about it, if someone strikes, kicks you, a Muay Thai guy hitting you on the outside of the knee, that's going to be an MCL injury. Okay, so that's the first thing to go, just like if you're a football player and someone rolls into you. When these offensive linemen, you'll see them in knee braces, that's usually not because of ACLs, although they think it helps their ACLs. It helps an MCL injury because if they get hit on the side, it actually stops their leg from bowing in. Now, those injuries are interesting because when I was in Pittsburgh, they would make the young guys see all these 5-foot tall, 350-pound women who slip on ice. Okay, very common injury up there the first time it snows. And they would have
trampolines
yeah,
too.
Yep, and they have
Big people
MCL
on.
injuries.
Yep.
And why did they make us see them? Because they all heal. Okay, 90% of them, you very rarely have to operate on them, but they hurt for 6 to 8 months. And so people keep coming back, it hurts, and you have to explain to them. And when orthopedists, we all hate when we can't fix something and it's going to heal over time because it doesn't make the patient happy. Okay, if we can't fix it, we know it's going to heal, then we do a myriad of other things to try to get them to be happier with their situation. So MCLs heal, and it's because it's a big, thick, wide ligament that is stuck between two planes. So it's like a peanut butter and jelly sandwich. If you tear the jelly inside the bread, but the bread is still intact and the peanut butter is intact, it holds it there. It just kind of all slushes together again and heals. The ACL is different. The ACL is like a rope, and the PCL are ropes on the inside of your knee which attach the bricks together. Now they're little ropes, and if they pull apart and break, they retract like a rubber band. And then since they never go back together, they don't heal. And then that's the problem, because those injuries are usually, getting hit from the side and rotating. If you watch football, it's almost always non-contact. They jump and they land on the knee. You'll see it in the UFC by, when guys, he'll kick a guy and they'll grab his leg and hold one of them. And then he jumps around, kind of that leg that's on the ground, he's being twisted, he lands. You'll see it with again, if you get hit in the side of the knee, oftentimes you'll tear the MCL, and if it's a big enough blow, you can tear the ACL on top of it. So you do both those things. And it's hard, that's a near impossible injury to compete with if you're if you're an MMA guy or a boxer. Now, interestingly, there's been plenty of really good jiu-jitsu guys who are ACL deficient, because they're not spending much time on their legs. Most of the time, especially in Brazilian Jiu-Jitsu, they do their best work on the ground, and you don't need an ACL for that. You need an ACL for planning and pivoting, and some people can get away without it.
Yeah, and so we talked about planting and pivoting, the main way, like football, soccer, anybody in those kinds of change direction type sports on their feet. In Jiu-Jitsu, though, it's often a contact type injury, and it can happen a lot of ways. The legs locked up, or how my way was a heel hook. And so heel hook is one of the top 3 submissions for creating an issue in the knee.
Yeah, your injury, because you see it. In fact, I'm going to show your injury. I have to give a talk in Pittsburgh at the end of the year on ACL injuries. And the other one that's on the internet, I just saw it the other day. And this guy was doing like the sit-up machines, but he planted his feet, and he's leaning back with a weight, and he goes back, and you see poo-poo.
Yep.
Both pop.
Both, right? I saw that one. Yeah.
And so you're looking at these things, you realize that it's a rope. So if you put tension on it and keep going, it's going to break. Just like if you're arm barring someone, you could break their arm. It's no different with an ACL, and that's what you see in jiu-jitsu. Like your injury, I knew it was coming. You could see it, and then you kind of rolled in, and I'm like, ugh, and pop.
Yeah. And so with jiu-jitsu as well, I think, this is an opinion, I think a lot of people walk around with partial tears, maybe not full like mine, because that rotation happens kind of more slowly, and you can spin, you can do things to kind of relieve the tension, and it's not totally too late where the whole knee explodes.
Well, and I know one of the best Brazilian Jiu-Jitsu guys of all time, who was a soccer player until he was about 12. Because at 12, 13, he had a knee injury. He didn't know what was going on. He's in Rio de Janeiro. He didn't have a doctor. And then he has another injury. And he said, I can't play soccer too well. I'll get him in jiu-jitsu. And I don't know that he's ever been beaten. I mean, he was amazing. And he came to me with a complaint of the doctor, because he had ACL injuries and 2 meniscal tears. They said they want to reconstruct them. And he's like, they're not, and it's a long recovery. And then when I have to start talking to him and looking at him, I realized that his ACLs have been out for 15 years.
Yeah.
So
from soccer or from jiu-jitsu?
From soccer.
Yeah.
Not even, so we went in, just took care of his meniscus, and on both sides, and he did great. He finished out his career. He's coaching and doing other stuff now. Never had him fixed because he doesn't do anything that requires them. And his style of fighting, he didn't need his ACLs.
So there are some people that we can say do not need the surgery.
Yes.
And jiu-jitsu, I think, may be one
Sure.
but you weigh the risks and benefits like I did,
Right.
and talk to people that you trust. So, I mean, I have wonderful colleagues and wonderful people in my network. How do you tell people to go find a doctor that they can trust?
Well, I think that, let me get back to that one point first. You have hockey players never had they don't need an ACL to play hockey, most of them. Now, why do they used to not get their ACLs fixed 25 years ago. Why do they get them fixed, especially now? Because probably around, in the mid 90s when the Penguins started getting big hockey players. They were all little guys, the Wayne Gretzky type. Then you started getting the Samuelsons and Mario Lemieux. These are big guys, 6'5", 240. And now they're training like football players. So they need to run, cut, clean, jerk. You need an ACL for all those activities. So you may not need it for the certain moves you're doing on the mat, but to train to be good at that and to cross-train like we all do now, you need an ACL for that.
And I think the wrestling component of jiu-jitsu,
especially if you're more of a judo guy, then you need an ACL. You can't be a judo person without an ACL.
So if you were to have somebody that said, look, I don't want my ACL touched, they say, what could happen down the line? Like, are there any repercussions to not doing it?
Absolutely.
Or doing
the same guy that I told you about that did fine, lost both of his meniscus because he had an unstable knee, and his meniscus was doing more than many people's do, and it tears. So when you have undiagnosed meniscal tears in a young kid, all of them, if they do that, and when they're under 14, every one of them will have irreparable meniscal tear by the time they're 20. Okay, and that's what leads to arthritis and leads to problems with the knee. So it's not as easy as, I don't want to get it fixed, I'm going to go play. You never hear during football, tore an ACL, and we're going to fix it at the end of the year. You hear tear the ACL, we're going to get it fixed, he's out for the year. In almost every sport you hear that, okay? So the sport that involves running, jumping, cutting. So, it's to protect the knee and allow the athlete a longer lifespan.
Yeah, awesome. So talking about ACL surgeries, you indicate somebody for an ACL.
Yeah.
What kind of talk do you have with athletes about what you're going to do?
So I think the important thing is if someone says, hey, you have an ACL tear, you got to sit down and have someone look at your knee and see how unstable you are, meaning how much they can move your knee, and then talk to you about what your goals are and what your training's like and what you're feeling. It's super important not to rush into surgery. ACL is not urgent surgery. The most important thing is when you have this injury, you're going to swell, you're going to get stiff, is to get right back in the gym, get on a bike right away, work on getting your full motion out, getting it straight, bending it, getting back to full lifting. It's aggressive prehab. And as soon as you tear an ACL, the neurologic connection between your brain and your quad muscle gets disrupted because there's a nerve in the ACL that goes back to the spinal cord. And it's amazing because as soon as you do it, you're going to start losing size and strength. And if people get put in a knee immobilizer or they takes 3 weeks to get in to see a doctor, they're way behind the 8 ball.
That's how we get them a lot because they went to the ER and they're in a knee immobilizer.
Exactly, and it's the work of the devil. I hate it. So I have a website that as soon as someone says, hey, I got a knee injury, I just send it to them. Because you're not going to hurt yourself by going on a stationary bike. And if you get that thing working immediately and start getting your motion back and get your quad working, you're going to do better sooner because an ACL is not, hey, it's a 6-month thing. Okay? It takes 9 months to get all your strength back, for the ligament itself to be strong enough to sustain a blow, and for you to start training aggressively again. Then, there's a difference between training and competing too. So NBA basketball guys are some of the best athletes in the world. And you go and take care of these guys and they're back doing everything at 9 months, okay? And by 12 months they say, I'm ready to go. Well, if you're a 1 or 2 guard, you're not going to be ready for the NBA at that time. It's going to take, between 12 and 18 months to really play well. And most people are on the latter end of that. I just had a guy that I fixed that's he's awesome, and he didn't mind me telling the story. But he came back, did well, but went from the NBA into the G League, and he was MVP of the G League the same year after he had his ACL done, and that is unbelievable. Now, what people don't talk about is how great an athlete it takes to be in the NBA. These guys are phenomenal athletes, and the better athlete you are, the better you're going to do. But even with those guys, it takes time. And I think the discussion I have with people right when they come in is, number one, get all your, the prehab part. And then number two, the length of time it takes. And then number three, the re-injury rate. Because I think you got to drive that home, especially in younger athletes. It's not zero. Between 14 and 22 years old, elite athletes have a 10% chance of re-injuring their ACL, 15% chance of tearing their other one. That is a big number. That's with the patella tendon or quad tendon ACL, the best surgeon doing it, and we have that data. That's not little, that's 1 in 10. You'd say, hey, I'll bet any day and 90%, I'm gonna go to Vegas and take that bet. Yeah, that's great, unless you're in that 10%, okay? Because you're not just betting $100, you're betting your life savings on this. So I think then I go in and talk to them about the actual surgery. That's the last thing I talk to them apart, because they have to understand what they're getting into, what they need, what they can and can't do, and what they're looking at.
Yeah, I think the biggest thing that I have also implemented since my injury, because a lot has changed about how I approach ACLs.
Absolutely.
Since mine. I almost learned more than residency when I just going through mine, was when I called you after I tore mine, and I was so sad. I was like, I'm out, this sucks. And you said, get on the bike right now. I was like, I'm already there. And so my right leg was bigger than my left leg going into surgery,
Right.
like my injured leg, because I was at the gym every day.
How long did
crushing.
you take before injury and surgery?
A month,
Yeah.
4 weeks, but I was every day.
On it immediately.
Every day I was in PT already,
Yep.
doing proprioception, so single leg balancing stuff, strengthening
Yep.
my glutes, doing pistol squats. I was, I was doing everything. I was leg pressing like a maniac.
Right.
And I just wanted to be as strong as I could, because that surgery is a second injury.
Yeah,
And
absolutely.
then you're back to square one. So you don't want to be back negative.
Yeah, which you will be. Many people, and they all want to rush into surgery. And I'm like, nah, just give it a little time.
Yep. All right. And so the next thing you said quad versus BTB when you were mentioning the rates of injury. So let's talk about that.
So when you're looking at ACLs, you can fix them in two big groups, either using dead people tissue or using your own. There's dead people tissue is not a good option if you're under 30. If you're over 30, it can be a good option. The older you get, it's a better and better option. What are the downsides? Well, the upside of it is it hurts a lot less. It's a faster surgery, and the initial recovery is faster. So
with the cadaver,
the dead people, yeah, the cadaver, the dead. You're getting dead tissue. So a dead guy, you're borrowing his tissue. And you don't borrow his ACL, you borrow the tendon from the front of his ankle, usually is what we use.
Keep it, don't give it back.
Yeah, we keep it. Yeah, we borrow it, we take it. But when we use that, it never totally becomes your tissue. Some people, their body attacks it a little bit. Other people, they don't incorporate it, it doesn't heal in as well. And some people heal in really well, but it's unpredictable. So the re-injury rate is higher. It kind of levels off at about 35. So 35 and over, we tend to do a lot of cadaver grafts. 35 and younger, we tend to do a lot of your own tissue.
What's the oldest person that you've done their own tissue for?
Probably 54,
Yeah.
And that's because they wanted it.
Yeah.
Which leads us to the second big group is borrowing it from yourself. So if you're on a younger or more higher level athlete, we're gonna take their own tissue, and you can either take a little piece of their quad tendon from above the knee, some of their kneecap bone, tendon and bone from the front, or some of their hamstring tendon. Now, the problem with the hamstring tendon is the failure rate's higher. And if you're a judo guy and you do a hamstring on someone, they'll hate you because you can't heel hook, you're gonna lose strength beyond 90 degrees of flexion. So when you start pulling here, you're gonna lose some strength. So I don't use that graft at all anymore. Patella tendons are good. It's a great graft. We've been using it a long time, but when you kneel on it, the chances of getting frontal knee pain are higher. So you spend a lot of time on your knees, that's a problem. Quad tendon doesn't have that issue, and the outcomes are almost exactly the same as patella tendon, but the collateral damage is a lot less. So that's kind of my go-to graft, but there's, outcomes-wise, there's really no difference between taking a quad and a patella tendon.
Yeah, and I agree with you. I learned quad from you when I
Right.
got to Atlanta because we were doing mostly the BTB, the patella tendon,
Right.
in training. When I see wrestlers or any type of jiu-jitsu, anybody that's going to be on their knees when they're competing, I do push them towards quad. But if any of my other athletes, I usually give them the option between the two, and I say exactly, we're not doing hamstring because of the higher failure rates, and then allograft or the cadaver is out of the question when they're young athletes.
Right, and I think the important thing is people get really caught up in the type of grafts. And I think there's some bad, like you got a 20-year-old, you don't want to do a cadaver. Or that's a bad choice, the dead person graft. But in that 20-year-old, if your doctor says, listen, I do patella tendon, I don't do quads, you want to do with what he's comfortable doing, or find another. If you really want the quad, you want to find someone who's done them, okay? And so when you're picking a doctor, if people are too dogmatic, if they say this is the best graft, I'm not sure that's a true statement. You could say this is the best graft in my hands. That's a good statement. If they say, look, I do all of them, I say, look, you can choose this. This is what I would recommend. Your mentor, when we started in about 2000, when did you train? What year?
When I was with Dr. Matava,
Yeah.
that was 2019 to 20,
Okay,
my fellowship.
so he was getting into, at the time, Matt's patella tendon guy, Jim Bradley, Walt Lowe, other NFL guys were all patella tendon. And I have this stat in 2013, I think or 14, my first quad tendon went to the NFL, and they downgraded them. Or said, well, when you sit there and you look, they were going to downgrade them.
Like in the combine?
In the
they took
combine.
them in.
So when you evaluate everyone before the draft, now Walt Lowe is 70% quad, and Jim Bradley's probably 35 to 40% quad, and they don't downgrade him at all anymore. And Matt's probably, I don't know what Matt is, he's probably 35, 40% quad. He's doing a lot of quads now. So we evolve too. So if someone, doesn't want to evolve and is stuck in what they do, that's great if you're not doing very many of these. But I think you got to ask someone, I think it's a valid statement. How many of these do you do a year? And is this your primary area of focus, or are you doing knee replacements or ankle replacements, or are you all over the place? And that allows you to pick someone who does a fair amount of these.
Yeah. The last thing I kind of wanted to talk to you about was with ACL injuries. So people come into the gym a lot, or they come see me and they say, hey, I had an ACL on this knee. And we just talked about what the importance is of the different types of grafts. You want to know what exactly was done. But there's a lot of other injuries that can happen alongside an ACL. So how does that change things? What should people look out for? What kind of questions should they ask their doctor to see if anything else is going on that is important?
Right. So if it's a significant MCL injury, not something the guy says, oh, on the MRI I saw, but you have a lot of pain on the inside of your knee, you got to watch for stiffness. So those people, we got to move. If you're going to have ACL surgery, you better get on a bike right away and you got to move. I don't use knee braces. I don't use them for most injuries, most ACL injuries. MCL, I will use them. I want these people putting weight on it pretty quick, and I want them moving quick. Now, if you had damage to the end of the bone, your articular cartilage, and they had to repair that, that's going to slow things down significantly. If you had a meniscal repair, again, it depends on the doctor. Unless it's a huge repair, I'm moving you just as fast. But you have to be aware that the progression is not to get back to doing sport in the first 3 months, or running in the first 3 months, or jumping. It's neuromuscular control, strength, and more strength. You got to get the strength back. We want you to have neuromuscular control, but often therapists are concentrating all that and not worrying about strength. You can't do anything without strength. So we start the leg extensions, leg curls, leg press, squats, lunges quickly. And it's not an ass to the grass type thing. It's doing squats slowly and where you're comfortable. But the faster we get your core region to your knees firing, the better off you're going to be.
Yeah, and I'm a big fan of BFR. I don't know if you send your athletes. I post a lot about it. It's like blood pressure cuffs on the thighs, and it kind of decreases a little bit of the oxygen. So you're working in more of an anaerobic state. Because as athletes, we want to be squatting more. We want to be, breaking our record, doing more, but you can't when you're right out. So BFR allows you to do more reps and feel that intensity.
Yeah, and BFR, especially in the beginning, once you can do a straight contraction, then people find it very helpful. It jumpstarts things. And sometimes the hardest thing to do after an ACL, as we know, is you see these people and their quads asleep. What are we going to do? We got to wake it up. And BFR is one of those things that people or athletes like. And it's simple. You don't need $1 million cuff. You can use a rubber band. You can use a blood pressure cuff. I mean, the thing that costs a couple grand, it's a blood pressure cuff.
Yeah. And the PTs mostly have it.
Yeah.
I bought a set because I like to go to the gym, and sometimes I'll put it on my arms. And if I don't feel like lifting heavy that day, just get a light set in with a lot of reps. It's rough. It's rough.
My son broke his ankle, so he's got to work his calf. So we did BFR, and he absolutely, after he got rid of that thing, because I never want to see that damn
miserable.
thing again. It sucks. I hate
hurts.
that thing. It works, but he said, that's good. I'm not training with that thing ever again.
Yeah.
So it's kind of funny.
Yeah. I mean, and to your point with the quad being asleep, I remember one of my first physical therapy sessions a week out, I couldn't lift my legs straight up.
Yeah.
And I started crying. I was just like, I knew this was going to happen, right? But when it happens, you're just in total shock.
It's and you know, I always call people on Sunday after the week after their surgery. I say, hey, could you do a straight leg lift? And then they get all kind of depressed. Well,
Yep.
you know, 80% of them, I can't lift my leg up. And I said, okay, that's normal. Can you contract your quad? And they said, I'm starting to see moving. I said, good. And you just keep at it, and sooner or later, they'll get it up. It usually happens within a week to 10 days. So we don't get too upset. And that's why I let them start walking on it or with crutches, just putting weight, because it helps that quad wake up.
Yeah. Another thing, stiffness, that we kind of talked about, just MCL injuries. I remember when I first started and I had a big lineman that had an MCL, and I called you and I said, man, this is a big boy. He's got a higher grade MCL. And I was like, what are the biggest things that you look out for? And you said stiffness, and not just MCLs, even though they are more prone to getting stiff. After ACLs, people get so stiff. And I have a bunch of friends post-op years out that can't sit on their heels. So how do you promote that safely in the beginning?
Well, the most important thing we work on in the beginning is extension. And that's our bane in existence. And I look at it, and there's an orthopedic surgeon named Don Shelburne who's in his 70s now, but he studied his patients, and he's always said, if you lose any extension, straightening, you're never going to get your strength back, you're not going to be as good. And we look at that, and so we get them, if we're in 3 months and that person can't get his leg straight compared to the other side, we'll do a quick little 3-minute surgery to go in and take out scar tissue. Then they can get their leg straight, then they're going to get strong faster. No one wants to do that, and people ignore that. But you ignore that in athletes, you're going to have problems. Especially if you're, look, if you're playing in the, NFL, you may get away with that, but you're not going to be as strong as you were before, and the average guy won't. And then the bending usually comes back, and while you're going to get as much extension as you're going to get by probably 3 to 4 months after, it's not going to get big more than that. Flexion, you're going to keep doing more, and you got to push it. And you don't stop. You got to do a child's pose, and it's going to hurt.
Yeah, it's pushing it,
And I think you got to. If you're going to take the time to undergo this operation, an operation not like an ACL, you got to buy into it, because it is not hard. There's an old movie called Brian's Song about Brian Piccolo, who died of cancer, and Gail Sayers has an ACL. Mm-hmm. And part of the movie was him coming back. And this is archaic ACL surgery. They would, in the 60s, when they cut your whole knee open, it ended your career most of the time. But the work and that it takes to get better from that has never gotten easier.
Yeah, I mean, I was doing 2 a days sometimes in PT just to get the swelling down.
It's brutal.
It's
especially
it's really
when you're trying to have a real job and you're on the feet as much as you are as an orthopedic surgeon. It's hard.
Yeah, I mean, I waited about 5 weeks to operate again, but even then, I would at the end of the day swollen, and just really
cold tub.
My ice baths. I know I got you into cold tubs.
Yeah.
The ice baths became very important. I couldn't ice bath for 2 weeks because I wanted my incisions to heal.
Right.
So there's videos of my friends like lowering me into the ice bath with my leg out.
Yep.
So that the incisions, because even just on the rest of my body, that effect it has
Sure,
for inflammation.
Absolutely.
Yeah. How do you like the ice bath?
I love it. For old guys, okay, so I'm old, and I'm stiff, and you get in there, and this is not like, there's a lot of things you can do that make you feel good, like massage. It makes you feel good. I don't know if anyone's ever shown a real benefit to it, but we all like it, and it makes me feel better. This is different, because when you go in there, there's a chemical reaction, and I know it's happening because I get out of that thing. And I don't drink coffee, but it's like I drank shots of coffee without the jitteriness, and it lasts all day at work, and it's addicting.
So no drop. You don't drop like
no,
coffee.
and it's full on addicting because I don't want to do. I wake up in the morning, it's miserable, and then I warm up a little bit, do my workout. By the time I'm at the end of my workout, I look forward to just hopping in there. And the first 30 seconds sucks, but then after that, it doesn't matter. You can stay in forever. And then you get out, and then there's that. Your warming up is like it's like energy exploding in your body, and it's norepinephrine.
There's dopamine. There's
dopamine, and something's coming up. There's a real response happening because your body's trying to make sure you don't die. So, but that stuff the rest of the day is awesome.
The funny thing is, you said that I don't think you're old, but you said, "Oh, I'm old and stiff." So a lot of people think ice creating more stiffness. So
see, it's funny because we ice people. Ice should stop the enzymatic activity. So people always say, "Well, isn't that bad for healing?" And you would think that if you ice just your ankle, sometimes you feel like you're stiff afterwards. But when you do it in your whole body, I every day I wake up with low back pain. Okay, and I'm just arthritis and from squatting and cleaning and all that. So I'm stiff. Now, if I take a leave, I feel better, right? But who wants to take a leave every day? I don't, and I'll forget. I guess sometimes you may need it. But when I get in that damn ice bath, if I'm really stiff in the morning before a workout, I'll get in for a minute. And then I get out, and it's like I've spent 45 minutes warming up.
Yeah.
And so that's not in my head. There's something going on there. So I don't care what people say. I don't know if there's data that backs it up. It's one of those things like it works for me, and it works for a lot of my. I was just telling you earlier. I've had a bunch of my buddies buy these things who are my age. I'm 59 as of Saturday. And that's horrible, you kind of think. But when you get in your 50s, it's harder to keep your training doing the same because you got everything against you. Your body's wearing out, hormones are down. It's not the same. You can't lift as hard not because your muscles can't take it, because your tendons and joints don't take it. So if I try to keep up with my kids and really lift, after about 3 weeks I have tendonitis. So I have to cross train better and do different things.
Well, the recovery is so important, and I've done a few interviews with athletes in their 20s, like young professional jiu-jitsu athletes, and they all talk about recovery. But then I don't think that should change when you are not in that, even when you're coming out of that pro sport. If anything, increase that recovery so you can stay doing the things that you enjoy.
The one thing that I'll tell as you get older is you never can take off unless you're injured, because when you take time off, it takes forever to get back. So the guys, if you continue what you're doing, and you got to cross train so you don't have these other issues, overuse issues. But the older you are, if they shut you down for 2 or 3 weeks, my dad is 97. My dad worked out. He still works out. He walks, he swims, and during COVID they shut down the pools. Now, he was in California when things were locked down. They shut his gym down and they shut his pools down, and that was brutal. They're worried about him getting COVID. He's worried about himself. And it took a year, and I don't know if he ever got back to the same level. But now that he's swimming every day, he comes out of there and he's like a new guy.
Yeah, just a month probably deconditioned him.
Oh yeah. Yeah. And it was more. It was like a 6-month period, and it was brutal there. But if you do that, in your 40s or 50s, I know you get busy, but figure out the time. That's why I do everything early in the morning. No one's doing anything at 5 o'clock in the morning except me. Right. And I get it all done. I go to work. Then when I come home, all hell's broken loose, and you can do everything.
Yeah, it's super important. Keeping up with it, and even in young people, doctor says, "Hey, look, you're out for X amount of months." Some of my athletes, they're like, "Okay, well, I'm done. I'm not going to do anything. I'm just going to sit on my couch, play video games." That is the worst thing that you could do.
It's a great thing, because I always look at people and say, these high school kids, so you blew out your knee. Well, you know what? That sucks. There's nothing good about that. But you got to turn a negative into a positive. And the people that have embraced the training, the weightlifting, I have people that come back bigger, stronger, faster, because they've never trained like that before. And especially female soccer players who all they do is play soccer all year round. They finally took a break from soccer and trained. And those girls come back as beasts. They're strong and they feel different. And they'll tell you, man, that was the one positive after going through this is, yeah, I took time off from playing, but I am a stronger, faster athlete now that I've trained appropriately.
Yeah, and we didn't really talk about the mindset part of it. I'm hoping to have a sports psychologist on too, because that's so, I thought that was bigger than the actual injury itself physically.
Absolutely.
Like my mind played so many games. I was having nightmares. I was really struggling. And then after the surgery, 2 days later, I'm with my like crutches and everything, doing one-legged push-ups, doing pull-ups, like getting my upper body and on the track.
Right.
And that helped my mind too.
Right, because the PTSD from any of these injuries is real. And if you've ever been injured, and it's not like, oh, I popped a hamstring, but if you've ever had a trauma, got knocked out, and if you do get injured, you're going to have to get through that PTSD part of things. And it's real in ACLs.
It's so real. Because even when I started getting back to training, people were very nervous to get after my leg. And I was very nervous. I would give up positions because I was like, nope, you could have it if my knee was compromised at all. But then after about a month or so, I was like, no, I actually need people people I trust to go after that leg.
Yeah.
And just put me in a little bit of a precarious situation, not where we can get injured, but where I have to defend it intelligently, where I have to keep putting myself into it. Because the first time somebody put me in the position where I got injured, I was sweating. I like stared at them and they freaked out, and I said, it's okay. We're going to be good.
That's why people, it's the first hit. You got to get drilled and then you say, you're back.
Yeah.
It's a question people always, how do you know you're ready to go back? Well, we could test your strength, your biomechanics, everything. We have all these myriad of tests to do, and we do a lot of it. But really, it comes down to two questions I ask them. Is number one, if your good leg is 100%, what's your other leg? And if you say like 95%, that's check one, you're ready. The second thing is there a little voice on your shoulder that says, like a little devil and angel thing. And if you're worried in the back of your mind that, hey, you're not ready yet. You got to progress more and get reps and get used to it. And that's called the fear index. We actually measure that. And that's super important. You want both those things to be, hey, I'm 95%, I'm not worried. Then you're ready to go.
Yeah. Awesome. Well, thanks so much. Is there anything else you wanted to add? Or
no, that's good. It was fun talking to you.
Yeah, thanks. Where can people find you if they want to come see you, meet
in Atlanta.
You?
I'm the only Dr. X in Atlanta. Happy to talk to anyone about their injuries, but I know a lot of people. If you need a recommendation or anything, I know people probably everywhere you guys live.
Yeah.
So,
how do you say your last name?
Zerroyens.
And it's spelt a little.
It's
different.
Xerogeanes. So everyone looked at that and said it's just X.
Yeah. So, and if you type in Dr. X, that's pretty easy to find.
I think it comes up.
It
or
does,
Emery X, and I'm probably the only one.
Yeah, cool. All right. Well, thanks so much again. Appreciate it.
An Ironic Media production. Visit us at ironickmedia.com.